Hello, I'm Dr. John. Welcome back to the office, Concept Physical Medicine. Today we're going to talk about the symptoms of stenosis. And we said last video that stenosis is the narrowing of the openings of the spine. It could happen at three places, or the most common places, which is the central canal, where the spinal cord is located, or the neural foramina, where the nerves exit the spine, and the space that connects those to the lateral recess, which could also occur, which is lateral recess stenosis. We also said that the symptoms could be from very mild to very severe with stenosis, and that 90% of the people 50 or over will develop stenosis, so it's very common. Stenosis can occur anywhere in the spine. It can occur at the neck, the cervical spine, it can occur in the thoracic, and it can also occur in the low back or the lumbar area of the spine. So when it occurs in the neck, they usually might have in the beginning a neck stiffness, neck pain, and as it progresses, you will get pain or tingling or numbness that could travel all the way down to your hands, and you might have hand pain or radiculopathy, radiating pain from the neck all the way down to the hand. You could also develop muscle weakness in the hand and hand pain. You could lose coordination with the hands and the muscles in the hand. You could develop trigger finger. You could develop lack of coordination, such as a hard time or difficulty typing, or difficulty using the mouse or the computer because of the hand motions. And you could also have difficulty typing or even buttoning your button because it takes dexterity to do that. So stenosis could lead to that in the cervical spine. In the thoracic area, it usually presents as pain all through the thoracic spine. And in the lumbar spine, it can present as pain in the low back. It could present as sciatica, that's pain, tingling, or numbness that starts in the low back that travels all the way down your foot. It can show up as pain going from sitting to standing. It could also show up as muscle weakness, lack of coordination when you're walking. In more severe cases, you'll develop something called drop foot, where you can't lift your foot and it drags. So you can see it's starting to get a little bit more serious with the drop foot. You could also, people don't realize this, but the nerves to the low back, besides going down the leg, the sciatic nerve this way, right, develops from the first 5 lumbar nerve roots and travels laterally all the way down your leg. These nerves also go from the lumbar plexus, go to organs. So when you have sciatica in the low back, it could affect organ function, such as you can lose bowel or bladder function. And that happens with some patients in the more serious cases. You could also develop difficulty walking or severe pain that goes down the leg. So stenosis is very common. And if you think you might have stenosis, please give us a call at Concept Physical Medicine. We'd be happy to evaluate you and determine your root cause of your problem. I'm Dr. John. I look forward to seeing you in the next video.